until Carvana makes one, I'm not interested.
Car selling made easy. On
Carvana.
pickup fees may apply.
Do you want free internet forever? Yeah, we thought so. That's why Spectrum is giving you just that. Free fiber-powered internet forever when you switch and get 4 mobile lines from Spectrum. No internet bills, no taxes, no late fees. Just fast fiber-powered internet. Call 833-901-0178 to find out how.
In a corner full of stories with a gentle, caring light, Paula is the voice that invites you to take flight. We'll talk of little smiles, tender touches, and sweet care. A show for moms and dads, a cozy space to share. No place is named, just a world of gentle play, where I'm Paula guides you warmly to learn along the way.
Hello, good evening everyone. Well, we're here. I'm sorry, we are sorry for the delay, but here we are. We finally made it, and I hope you had a wonderful day today and still on. And today is very special. This episode we have a specific topic. We're gonna talk about mental health, and we have a guest. My name is Paula Laria. I'm an international board certified lactation consultant, a nutritionist from Argentina. And here I'm going to present to you Jasmine Justi. She is therapist, specialized in substance use, addictions, anxiety, bipolar disorder, depression, and PTSD. Jasmine is a licensed trilingual psychotherapist with more than 15 years of experience in the mental health field. She earned her bachelor's degree in the University of California, Berkeley, and her master's degree at Columbia University. She has experience working in hospitals and residential programs, both inpatient and outpatient, as well as in community clinics through the County Department of Mental Health. She directed a dual diagnosis addiction program at UCLA for several years. She's the author of her first poetry book, I will say, because I'm expecting many more. The name of the book is The Geology of Being, Poems on Humanity. And she has traveled and lived in several countries, and she's the mother of a beautiful child. Welcome, Jasmine.
Thank you so much. Thank you for having me.
Of course. And this is our third episode of the live breastfeeding support group streaming, where we have this space for the parents. So whoever wants to communicate and connect and send questions to the chat, please do it because we're here for you, right? The whole idea is that If you have any question, this is your opportunity to talk with Jasmine or to talk with me, and we're gonna try to make the best of this time to answer all the questions as possible. Okay? But to start with our topic for today, we are talking about perinatal mental health, right? What's the difference between baby blues and postpartum depression that we used to know it as postpartum depression before, but now is perinatal depression?
Yeah, so we can get started. Well, first starting with the name change, right? For most people, they think of it as postpartum depression. But the reality is that more and more we're recognizing that a lot of the symptoms that come with this condition happen actually during pregnancy, maybe even in the last trimester or the last couple of months. Hence the change of the name from postpartum to perinatal depression. So, what is it? Similar to when we talk about clinical depression, it shares a lot of the same symptoms, whether it's a lot of sadness or crying spells, a lack of motivation or interest in doing things, sometimes the loss of pleasure in things or connecting with things, isolation, changes in our appetite, changes in our sleep, sometimes having a lot of negative talk to ourselves or a lot of pessimistic views of ourselves or the world. And in cases more severe, it can even lead to having thoughts that we don't want to be alive or even wanting to end our lives. That's clinical depression. When we talk about perinatal depression, it's sharing a lot of the same symptoms, but there's also symptoms that specifically revolve around maternity. So for a lot of women, that can look like having difficulty connecting with the baby or having a desire to connect with the baby. It could be a lot of extreme fears or anxieties that they're not good mothers or that something's going to happen to the baby or that the baby's at risk. In more extreme cases, even having fears of harming the baby or having thoughts of harming the baby. Those are some of the things that people who experience perinatal depression may have. When we talk about the baby blues, it's usually some of these symptoms, maybe some sadness, maybe some fears, maybe some ups and downs in emotions, but they're usually a lot less intense in how often they happen or how severely they happen. And for most women, they tend to slow down or go away after a couple of weeks, whereas the perinatal depression seems to be a lot more intense and long-lasting, sometimes for months or longer.
So it's surprising for me that it can happen during the pregnancy, and sometimes we don't even notice, right? The mom starts feeling sad, and she may not even mention anything about it because it's weird to feel sad during your pregnancy or to have those type of symptoms, right? I usually describe baby blues like a roller coaster of emotions, right? Moms come to me and they say, I swear I'm so happy that I have this baby, but I don't know, I'm crying, why I'm crying, right? It's like, I know I'm happy, but I don't know, it's 1 second I'm laughing and super, super happy and hugging my baby, and then at the very next second, I'm crying, or I have a smile and my tears are coming down. That's more like a baby blues, right?
Right. It can look like both. But if we notice that it's something that comes and goes and we still have the ability to function, to connect, to do a lot of things with just, moments that come and go of having that, then maybe it's not as severe. Whereas with a perinatal depression, it might be all encompassing all throughout. We're constantly in that state.
If I'm having these feelings, but I still know that I want to eat, I want to take care of myself, I still want to take care of my baby. I'm a little bit sad because I'm going through all these changes, but it's something that I can still handle. It's fine.
Yeah, I mean, regardless of what the severity is, it's always good to talk about what's going on. It's always good to get support, right? But generally speaking, those are maybe more temporary feelings that come and go.
And how long does it usually last, the baby blues?
It's usually a couple of weeks for most people, right? A couple of weeks. If we notice that it's ongoing, it's so severe, like you said, it's hard to function, then okay, maybe there's something else going on.
And how often do you think that postpartum blues happens?
So we have some statistics for the CDC, right? The Center for Disease Control. When we talk about statistics from mental health, I always have a word of caution. Even now that it's 2026, right? We're in 2026. There's still so much stigma when it comes to mental health. And especially when we're talking about maternal mental health, where people might not feel comfortable, people might not feel safe talking about what's going on, or even identifying what's going on. And if professionals, on the other hand, are not asking the questions or are not providing a space that feels safe to have those conversations, there's a lot of people who may be having these symptoms or having these experiences who are not talking about it. So as much as we have some statistics, it's important to know we don't know how accurate or representative these statistics are. With that disclaimer, what we know from the CDC, at least in the United States, it's that when it comes to perinatal depression, it's about 1 in 8 women. So it's, 13, 15% of women who have children will experience that, absolutely. And when it comes to the baby blues, it's like 80%. So incredibly common, right? Mm-hmm.
I realized that in one trip that I have the opportunity to do one time with this program called Mom 2020 or 2020 Mom, that they were doing a special conference in maternal mental health, and they talk about all these numbers, and I was like, that's unbelievable.
Mm-hmm.
And how many times, as you said, we still don't talk about it that much, or many times you're like, what do you say, you just had a baby, like
Mm-hmm.
you're supposed to be happy.
Yeah, the expectations and the pressure of how you're supposed to be feeling, and that's a whole barrier.
And that's one of the reasons why many times mothers will be quiet about it.
Mm-hmm. Mm-hmm.
And they will isolate themselves because it's like, how come I be having these
Right.
ideas,
Sure.
and who will be the right person to share with?
Right. Right. Absolutely.
So what will be different ways that we can treat this?
So I think one of the biggest things is the emotional support. Now, the emotional support can definitely be coming from a professional, right? Whether it's a therapist, a psychiatrist, a doctor, but it's also the support from the community. If you have the privilege of having family, having a partner, having friends, having people that you could talk to about the things that are going on, that alone is huge.
And just be listened.
Absolutely.
Yeah, right.
Absolutely.
They don't need to tell us how to solution this.
Exactly. Just being able to say, hey, this is what's happening, and having someone say, oh my gosh, that's hard. Or even, support groups are great. Whether the support group is a therapeutic support group where people come to talk specifically about those things, or even if it's just a group of moms who get together, or a group of, like a mommy and me class, or a lactation group, or any kind of space where we could talk with other people who can say, I know what that feels like, or I've had it too, or I'm going through that right now, that humanizes and normalizes the experience when we might feel super isolated.
Yeah, that's another thing that I learned in that conference, is the fact that, of course, there will be cases where they need professional advice, treatment, medication in some cases.
Sure.
And as for you to know, many of the medications that are recommended for the treatment of depression are compatible with breastfeeding.
Right.
So that's a really good thing to know.
Yes.
Because sometimes mothers are afraid of taking their medication,
Yeah.
because they don't know if they can continue breastfeeding.
Mm-hmm.
And knowing that it's safe, we need a happy mother
Mm-hmm.
to have a happy baby.
Absolutely.
The most that baby needs is a happy family,
Mm-hmm.
right? So that's important. But the other thing that I learned is that providing a space. Like I have a breastfeeding support group, and I can see the mothers when they come to the breastfeeding support group feeling like,
Mm-hmm.
I can be free and I can talk.
Right.
Like we had a mom telling us that she had the baby in the car and she needed to share all her experience, or the fact that I had a dream, but the reality is this.
Mm-hmm.
Right? It's a
Right.
completely different reality, and the expectation
Mm-hmm.
change and the feelings are super strong when things like that happen, right?
Yeah, absolutely.
So, what do you think are the things that we can do during pregnancy, or preferably during pregnancy or postpartum, to prevent
Mm-hmm.
depression?
So when we talk about mental health, I think it's super important to recognize that there are biological things, psychological things, and sociological things that impact our overall mental health and our experience. So when we talk about biological things, we could be talking about things like genetics. Is there a history of mental health conditions in our family? Or have I had mental health conditions in the past that might make me more predisposed to developing these same symptoms or diagnosis during pregnancy? If we have other conditions, other physical health conditions, if we have diabetes, hypertension, if we have chronic pain, all these other conditions are also going to have an impact on our mental health, right? And then when we look at the biological changes that happen in pregnancy and postpartum, there's so much to be said about that, right? But one of the biggest things is hormones. The surge and the drop in hormones that happens in the body for a woman who is pregnant and then gives birth.
Is it possible
Huge.
that this balance or specific hormone can produce symptoms of depression?
Absolutely.
And maybe with a medical treatment and other therapies
Mm-hmm.
help, but she really needs that thing that is missing? Or is it possible that she's lacking a vitamin or a mineral?
Yes, absolutely. All of those things can have an impact. If we think about something like PMS, for example, premenstrual syndrome, which a lot of women go through, right? Maybe a couple of days or a week before getting their period, they notice that they're super sensitive, or they're very sad, or they get angry, or they're irritable, right? And all these things come, and then the period comes, and all of a sudden,
You're like, yay!
nothing happened, right? That's hormones for you, right? That's hormones, how powerful they are. I was reading something that said the drop in hormones 24 to 48 hours after we give birth is anywhere from 10 to 50 times stronger than when we go through a PMS episode. So imagine that, 10 to 50 times more, right? So it's only natural that we're gonna have all this surge of emotions that feel so intense. And I think what's interesting too is that it says 10 to 50. That's a huge range. And I think that speaks to how every single one of us has a different body with a different baseline. So what my hormonal changes are going to look like are going to be different from yours, from other women. And therefore, the impact that that's going to have on our emotional state or our mental health is going to be different.
Yeah, definitely. I was also thinking when you mentioned about all the changes that happen at biological level, there is changes in the brain.
Yes.
I hear that there is some part of the brain that will be focused in survival mode and taking care of the baby.
Mm-hmm.
And no matter how much you want to try to be able to memorize all the things that you were trying to memorize before and taking care of all the things, there is a physical reason why you're not able to do it.
Mm-hmm.
That mother brain.
Yes. The literal mass of the brain changes size. Like, that's how crazy it is, right? The prefrontal cortex that has to do with decision making and reasoning and pragmatic thinking about things, logical, actually shrinks to give space to the back of our brain that's more animalistic and instinctual and full of emotion, right? Like the sensible, sensitive part of our brain that also has to do with fear and safety grows. And it is to be mindful of protecting the baby, connecting with the baby. And maybe a side effect of that is that we feel everything so strongly because that's what our brain is making us do. So these are all, among many others, biological things that happen. Now, in terms of, okay, what do we do with that, right? We can't necessarily control that these changes are going to happen. But just the knowing the awareness, the education, like, okay, I'm going to go through this change. And so that when it happens, instead of saying, oh my God, what's wrong with me? Am I going crazy? Why can't I remember things? Or why can't I function? Or why am I crying and laughing and all these things? All of a sudden it's like, okay, I'm going through this wave. This is what my body is doing. This is what my body needs to do. And I can address it in a different way or navigate it in a different way.
And accept it.
And accept some of it, right?
Let it happen. It's like, okay, this is the moment to be this way.
Right, absolutely. And within that, right, a lot of the times we think of mental health and physical health as if they are two different things, right? Like physical health is here and maybe mental health is some abstract concept of the mind. But we experience our emotions in our bodies. And sometimes it's about taking care of our bodies, doing what we can to eat well, regulate our sleep, move our bodies, right? Those things can actually have a huge impact on our mental health, and not taking care of those things also.
Yes, and observing that if you are spending too much time inside the house, if you're isolated, I see mothers that will be a whole month inside the room without even going to the living room, or just because the room is upstairs, I better stay here, somebody's taking care of me, and then they don't even realize that they spend the whole month inside the room.
Sure.
That's affecting them, not seeing the light.
Yeah, which is physical and also psychological, right? And so when we think about the psychological things that happen that impact our mental health, is paying attention to what are the thoughts and feelings that we have even coming into pregnancy or during the pregnancy, or as we give birth and motherhood, right? Like we were talking about expectations. There are some women that had an idea of what they wanted or what they imagined that pregnancy was going to be. And maybe it turns out to be exactly like that. And maybe it's very different from that, right? Maybe they are tired all the time and that's uncomfortable. Maybe they're super nauseous, or the changes in their body bring up.
They thought that they were going to be working until a month before, but then either baby came earlier and they were never able to take that month to fix everything that they wanted to fix.
Right.
Or they need a bed rest and they had to be in bed rest for 3 or 5 months.
Sure.
During the pregnancy. This happens all the time. I think the biggest, I would say, frustration or pain for the mothers when they come to the office is like, I wanted to have a natural delivery, no medications, in my home or in the birth center, but I ended having an emergency C-section. So what happened with these situations?
Right. So part of it goes back to if we can bring awareness and education to, okay, this is what I would like. These are all the different options of what can happen, and how can I mentally prepare? Even as I hold on to my idea of what I would like to happen, how can I mentally prepare for the possibility that all these other things might happen? And also, what is the story that I tell myself? Because a lot of the times I think what happens is that we end up feeling somehow guilty or responsible. What's wrong with my body, or what's wrong with me that I couldn't have the pregnancy that I wanted, that I couldn't give birth in the way that I wanted, that I wanted an unmedicated labor and I gave up, or I couldn't, so I had to take the epidural and I wasn't strong enough, or whatever messages we tell ourselves, right? Bringing awareness to that and talking about that, and sometimes talking about that with a professional or with friends, or hearing birth stories, different birth stories that normalize and humanize the diversity and the plethora of experiences that happen with or without our consent or desire or what have you.
Yeah, most of the time.
Most of the time. There's always a story.
We have a plan. The possibility that the plan is going to go the way we want is very, very difficult.
Right.
Baby comes when baby wants.
Right. And there are a lot of things that are going to happen in our bodies that we're not going to control.
Completely out of
Yeah.
control.
Yeah.
But think it will be nice to take from this streaming, from this episode, will be the fact that the power of knowledge,
Mm-hmm.
right? It won't make things, sometimes you won't have the opportunity to prevent,
Mm-hmm.
but it will help you to navigate in a different way, right?
Sure, absolutely. But again, just like we can do things to take care of our physical health within the realm of our possibility, we could also be proactive in taking care of our mental health, right? In talking, even as we're going through the process of pregnancy, of how we're feeling or the things that are coming up for us. Some women maybe always wanted to be mothers. Maybe for others, it was a surprise and here they are. Maybe for others, they've been trying for a long time and maybe they have experienced a loss or a handful of losses and now it's happening, right? That is going to bring a lot of things for people. Another thing is sometimes motherhood can bring up stuff about our own relationship with our own mothers or our own caregivers and who raised us. And if we had difficult experiences with that or traumatic experiences with that, all of that can come up when we're suddenly on the other side. And that could be activating.
Yes, talking about that, I had many times grandmothers taking care of the daughter that just had her baby in the hospital, and 20, 30, 40 years later, she's crying and sharing with me how traumatic was her experience, because I think at this point, let me know if I'm wrong, she was never able to work it out.
Mm-hmm.
Right? So she's still in pain. 30, 40 years later, she's still crying for that birth that she couldn't have, or because she couldn't breastfeed her baby. What about that?
Sure. Yeah. Yeah. Anything that doesn't get processed can get stuck. And then it feels fresh every time we talk about it as if it just happened, because we maybe never had the space, the opportunity to talk about it in a place that feels safe and with someone who can help us and discover what that did for us. And breastfeeding is another example of that. There's so many expectations or ideas that we can have about what we want it to be. And also the pressures from society, sometimes from moms, right? The pressure of, oh, you have to breastfeed, or it has to look like this, or it has to look like that. And it's all this noise over things that we may or may not be able to control. And that's really hard.
So, Jasmine, do you know any resources that we can offer the parents here? Just to mention a few of them, we're gonna put it in the description of the video.
Yeah.
But what are the resources that we have in there?
There are a lot of resources, both from the mental health standpoint, right? Resources to be able to talk to therapists or to psychiatrists, support groups of different kinds, but also the other aspect, right? From a biological, psychological, sociological. Sometimes it's about accessing basic needs. Sometimes it's making sure that we have stable housing, that we have food, that we have, basic things that we need, maybe resources for the baby. So there are a lot of programs out there that are meant to help with every part of the way.
We have nutritional program, like the WIC program is available for parents with low-income resources.
Yes.
Right?
Yeah. There's a lot of stuff. There's
So
a lot
all
of stuff.
that information will be in the description of the video. Do you want to give a final message, like a general idea? What would you like to say to the patients and how they can find you, to our audience, and how they can find you if they need your help, if they want your help?
Sure. So I'm a licensed psychotherapist. So if you want to work with someone in Spanish or in English or in Portuguese, I think you're going to share my information if you want to connect with me. Absolutely. The main thing is there are 8 billion people plus on this earth, right? A lot of the times when I'm working with different clients, they're like, is this normal? Is that normal? And I'm like, it's happening to you among millions and millions of people. So it's happening in nature. It's natural. And it doesn't mean that it's pleasant. It doesn't mean that you have to deal with it alone, but just normalizing and humanizing the experience. This happens to a lot of people. Struggling with mental health doesn't mean that you're weak, doesn't mean that there's something wrong with you, doesn't mean anything other than life is difficult and a lot of things come up biologically, psychologically, sociologically, etc. You don't have to do it alone. Talking with someone and getting support at all these different levels can make a huge impact. And don't be afraid to speak up.
Don't be afraid of speak up. If you are in the area of the Santa Clarita, I'm gonna have a breastfeeding support group in person tomorrow at 10 in the morning. You can look for my information at Breast Time of Life and reserve your space. I will be more than happy to see you. My phone number, if you wanna text me, 818-571-0494. And this is it. Wonderful. Thank you so much, Jasmine, for coming.
Such a pleasure.
You're more than welcome to come back whenever you want.
Okay.
We want to have you again. Thank you
Okay.
so much.
Thank you.